Assalamu alaikum. Many patients diagnosed with hemorrhoids often ask, can hemorrhoids eventually turn into cancer? The clear answer is no. Hemorrhoids do not turn into cancer. However, it's crucial to understand that some symptoms of hemorrhoids can also occur in colorectal cancer. Therefore, rectal bleeding should not be assumed to be caused by hemorrhoids without proper assessment. So, what are hemorrhoids? The anal canal naturally contains vascular cushions made of blood vessels and supporting tissue. When these tissues become enlarged, bleed, or protrude outside the anus, they become symptomatic hemorrhoids. They are a benign, non-cancerous condition and do not transform into cancer. Why does this misconception exist? Both hemorrhoids and colorectal cancer may cause rectal bleeding. Some patients treat the bleeding as hemorrhoids for months or years without examination. If cancer is later diagnosed, people may mistakenly believe that the hemorrhoids changed into cancer. In reality, they are separate conditions. Common symptoms of hemorrhoids include bright red rectal bleeding, blood on toilet paper, a lump protruding from the anus, itching or irritation, mucus or moisture around the anus, and pain or swelling in some patients. However, these symptoms alone cannot confirm the diagnosis. Colorectal cancer may also cause bleeding, but additional warning signs include a persistent change in bowel habits, repeated constipation or diarrhea, narrower stools than usual, persistent abdominal pain or bloating, unexplained weight loss, loss of appetite, anemia, or continuing fatigue. These symptoms require proper assessment. Who should be particularly careful? Seek medical advice promptly if you are aged 45 or older, have a family history of colorectal cancer or polyps, experience recurrent or persistent bleeding, have anemia, are losing weight without explanation, or have changed bowel habits. How is the cause diagnosed? Your doctor may start with a detailed history and physical examination. Depending on your age, symptoms, and risk factors, further tests may include examination of the anus and rectum, proctoscopy, sigmoidoscopy, colonoscopy, blood tests, or biopsy of any suspicious abnormality. Not every patient requires every test. Investigations should be tailored to the individual clinical situation. Does treating hemorrhoids prevent colorectal cancer? No. Treating hemorrhoids controls symptoms but does not replace colorectal cancer screening. A patient eligible for screening or with warning symptoms may still require further evaluation, even with hemorrhoids present. A common mistake is using creams, suppositories, or home remedies whenever bleeding occurs. Symptoms may improve temporarily, but the true cause of the bleeding remains unknown. Rectal bleeding is a symptom, not a complete diagnosis. A proper examination is needed to identify its cause. Today's key message: hemorrhoids do not turn into cancer. However, having hemorrhoids does not mean every episode of rectal bleeding is caused by them. If bleeding recurs, symptoms change, or warning signs are present, consult a qualified surgeon or gastroenterologist. Early assessment provides the best opportunity for effective treatment. For reliable information about hemorrhoids, anal fissures, anal fistulas, colorectal cancer, and other common surgical conditions, visit Professor Dr. Zahid Mahmood's website at www.professorzahid.com. Please share this video with your family and friends. Remember, not every episode of rectal bleeding is caused by hemorrhoids, and timely evaluation can protect your health and life. Allah Hafiz.